everyone! It's me again, Alona. So, pag-uusapan natin ngayon is colostrum, breastfeeding. Okay? I had two moms last month wrote me and asked me some advice about what is going on sa colostrum nila while they were pregnant or after giving birth. Okay? So, may mga incidents na nangyayari na during the third trimester, let's say during the 8 months or 9 months of pregnancy, nagkakaroon ng colostrum si mami at ang kulay ng colostrum is somewhat like bloody pinkish color. Okay? I-explain ko sa inyo kung ano yun. So, this is not very common during the third trimester, but it happens sa ibang mga nanay na nagkakaroon sila ng tinatawag na RustyPipe syndrome. Meaning, it's a blood-stained colostrum na ang kulay may pagka reddish-pinkish na makikita nila either sa bra nila or after they gave birth. But kalimitan nito is during the third trimester. So, don't panic kung may nangyayari sa itong ganito. What is the cause of that? Anong dahilan kung bakit nagkakaroon ng mga ibang nanay ng ganito? The explanation based on research, pag buntis tayo, nag-change yung hormone natin. Okay? So, when our hormone is changing, ganun din yung colostrum natin. So, it triggers when there's changes of hormone in our body, and then that hormone, one of the hormones that help us to produce the milk, kaya nagkakaroon tayo ng RustyPipe syndrome o yung colostrum natin habang buntis tayo, nagkakaroon ng kulay ng blood-stained colostrum. So, it is safe, hindi nakakatakot na incident. If you are very worried about it, if it happened many times, not just once or twice, but kung nangyayari like araw-araw or every week nagkakaroon ka ng ganun, make sure you get it checked, okay? Kung may concern ka. But to be honest, based on research, walang very, you don't have to panic. It's not a major concern na magwo-worry ka na kung anong mangyayari sa pagbubuntis mo. It is just yung colostrum mo, yung milk mo, nagkakaroon ng blood stain yun, na mawawala din yun. If after birth, nangyayari pa rin ng ganito, some moms, para mawala yung RustyPipe syndrome na yun o yung blood-stained milk na yun, ang ginagawa nila, if you can do it, nagbe-breast pump sila para matanggal yun. Para matanggal yung kung may kunti man dugo. However, nangyayari ito sa isang pasyente, the more she pumped, the more blood came out. So I told her, stop! Do not force it. So ang ginagawa ko, if this continues happening like this, ang ginagawa ko, my advice to my patient, let it rest. I-rest mo muna yung breast mo maybe for a day or two. Kunti lang massage, but wag mong puwersahin na ilabas yung gatas para mag-stop yung bleeding. Okay? If it's uncomfortable, you can put a cold towel. Ilagay mo muna yung wet towel sa freezer mo maybe for 5 minutes or 10 minutes. Then ilagay mo sa breast mo para it cools down if there's any inflammation doon sa loob. Okay? You need to also make sure na pag nag-pump ka, you are properly regulating the pressure or the speed of your pump. Kalimitan kasi, yung ibang mga nanay, sa sobra nilang impatient, na gusto talagang magkaroon sila ng maraming gatas kaagad pag nag-breast pump sila, gusto nila na ilagay talaga sa high pressure yung breast pump pag nagpa-pump sila. So, take note, when you're breast pumping, and you want a good result doon sa pagpa-pump mo, you have to mimic, gagayahin mo yung rhythm, mechanics ng sucking ng baby when it comes to breastfeeding. So, in the first few minutes, sa breastfeeding, ang sucking ng baby medyo mabilis. But after mga 2 minutes or 3, medyo every second na lang. Kasi, pina-follow ni baby yung flow ng milk. Ganun ka rin pag nag-pump. So, you need to mimic, gagayahin mo yung rhythm ng sucking mechanics ng baby while breastfeeding when you're using the pump. Another way that you can improve your milk input is, or output, sorry, making sure na i-massage mo rin yung breast mo before you pump, massage it, put a warm towel, massage mo muna ng konti para ma-stimulate yung breast mo, then that's the time you put the breast pump on. So, kung magkakaroon ka ng blood-stained colostrum after birth, you can throw it away kung gusto mo, pero kung ayaw mong masayang yung colostrum mo after birth, dahil very precious yun, you can still feed that stained blood colostrum to your baby. Some babies probably susuka or don't like the taste of it. Kung ganun ang mangyayari, don't force it. You can throw it away. Depends kung gaano ka kadami ng colostrum. Okay, it happens to some of my patients. So, kung si ma'am ayaw munang mag-breastfeed nung nakita niya na nagkakaroon siya ng blood-stained colostrum, kung medyo disappoint siya at ayaw muna niyang ipalatch si baby, she can go ahead. She can have other option kung anong ipifeed the baby, either artificial milk. Okay, as long as komportable siya sa ginagawa niya. So make sure, mom, that you understand. Now, once you give that artificial milk to your baby during the first day of birth, yun na yung magko-coat sa stomach ng baby or sa lining ng intestine ng baby for few weeks. So, instead of colostrum ang nagko-coat doon sa intestine ng baby mo to protect any digestive infection, nagkakaroon tuloy ng allergy reaction si baby. Because some babies are allergic to artificial milk. So, yun din ang risk kung bakit advice talaga sa mga moms that after birth, you need to make sure that the baby got the colostrum first before giving any formula. Now, some moms probably feeling anxious, natatakot, hindi malaman kung anong gagawin. So, this is the time na kailangan nyo talaga ng support. Okay? Do not hesitate to ask questions. Alam kong busy ang mga nurses around you, but making sure that before you step out from the hospital at may mga concern ka, make sure na kausapin niyo yung mga nurses niyo or yung doctor niyo regarding your issue. Kasi pagdating mo sa bahay, ikaw na lang. Hindi mo na pwedeng makontak the middle of the night yung doctor mo or nurse mo. So, make sure that ready ka before you go home para pagdating sa bahay, hindi ka nagpapanik, hindi ka nervous kasi there are so many things can happen during the first day, second night, or third night sa bahay nyo when just you and your partner or some of your siblings. So, it's important na alam mo yung dapat mong gawin in case mangyayari sa ito ng ganito, okay? So, I'm very happy to share the experiences that I have as a nurse before kasi maraming mga nanay ngayon na kulang talaga sa kaalaman. At pag kulang ka sa kaalaman, nagpapanik ka. Because you're not prepared. Hindi mo alam kung anong gagawin mo because you're not prepared. So, panic is an emotion for a person who have no knowledge at all. So, kailangang alamin mo yun, kung anong, bakit ba yun. Magbabasa ka na, but make sure, whatever you read in internet, make sure that reliable resources yung binabasa nyo. Ang daming mga fake news, false information, pinopost about this, about that, without proven research. Kaya, kailangan talagang, when you give information as a healthcare provider, make sure it's evidence-based research. Hindi yung sabi-sabi lang or hindi yung gaya-gaya lang because it's your license that you're taking care of. So make sure you give evidence-based information sa mga nanay na nangangailangan ng information para mas confident ang mga nanay on how they can take care of themselves as well as how they can take care of their own babies. So thank you for watching again. I'll have some more videos Please continue to subscribe, follow me, ask questions, like this video, and I'm pretty sure na magkakaroon pa rin ako ng maraming time to upload more videos about nursing, about education, and about life. Thanks again, and have a really nice day.